Hi, I'm Captain Tim Lavoie of the Bedford Fire Department. At the Bedford Fire Department, my job is risk management and administration. Part of that is educating the public on what it is that we do on a day-to-day basis here at the fire department. Part of that you'll see recently was that I did a Facebook post for one of our members who just went through an intensive program to become a paramedic, licensed not only here in New Hampshire, but across the United States. So I want to introduce you to firefighter paramedic Albert Kozacka. And over the next few minutes, we're going to be talking with Albert about what it really means to become a paramedic and all the hours and the training that's required to do that, and also some of the equipment in one of our ambulances here that we use on calls to help members of the public. First thing I want to ask you, why did you want to take this step into becoming a paramedic?
So I wanted to take this step because it's the highest level provider you can be as far as EMS goes, being on the ambulance. It's a huge stepping stone in a firefighter's career to achieve their paramedic. And there's a lot more things you can do to help the community as a paramedic.
Yeah, what a lot of folks don't know is that there's actually 3 levels of pre-hospital care. There is EMT basic, there's advanced EMT, and then there's paramedics. And paramedics can do a wide variety of things above each of those other levels. So it really is a very huge commitment. Not only you put your private life on hold to go to school, but it's a large commitment because there's a lot of responsibility involved to becoming a paramedic as well. During your schooling to become a paramedic, was there something that you really didn't know prior when you were in AMT that you learned in paramedic school?
So just being involved in the job and being an advanced EMT and working with paramedics before, I kind of understood what they did, but I just never knew the extent of all the knowledge and the learning process that they had. Some of the cool skills that we get to do and learn about. Intubation's one of them. I've never done that before in my career.
Can you just explain what intubation means?
Yeah.
It's maybe a term that folks might not know.
So intubation is a way to secure somebody's airway. So if somebody is unresponsive, maybe vomiting, it's basically a tube that goes right down into their airway. And it's a way for us to breathe for the patient, as well as keeping secretions, foreign bodies out of their airway, so it really protects their airway. And another skill, a huge skill we get to learn is, we get to push a lot of medications, a lot more medications, and also using electricity. So we can pace patients, so if their heart is beating too slow, we can use our LifePak 15, which I can show you in a minute. So if the heart's beating too slow, we can actually speed it up using electricity. And also if it's beating too fast, we can kind of reset the heart using our LifePak. So those are some neat skills that I learned. There's many more. Those are kind of the big ones that a paramedic learns throughout their schooling.
All right, so Albert, why don't we take a minute, hop inside the ambulance, and we can show some of the folks the equipment that we'll use on various medical calls. All right, so we're here in the back of ambulance 2. This is one of 3 ambulances that we have here at the fire department, and Albert's just gonna kind of go through our intubation roll here a little bit, and then over our LifePak monitor. So I'll let you go ahead and take it, Albert.
So this is our intubation roll. It's filled with different sizes of tubes that we use, and also our blades. So we have Mack and Miller blades, which are just different styles, and these are used to actually open up the airway and get a look at where we need to place the tube. So the tube here, it's a simple plastic tube. On one end you have a cuff that you inflate to kind of close it off so no vomit or anything can get down into your lungs. And on the other side you have an adapter, and that works by attaching our BBM to it. And basically all you do is breathe for the patient, and the air is going to go down through the tube and into the lungs.
What's one way, I know there's a few, but what's one way you can verify that you actually have a good tube placement with a patient that you need to maintain their airway?
So you're going to use a stethoscope, and you're going to listen to the lungs to make sure that you have air going into the lungs, and you're also going to listen to the stomach, because sometimes you can go down the esophagus if you miss and put air into the stomach. So you just want to verify that it's in the lungs. And there's also some devices called Untitled, which reads the CO2 coming out of the tube. So that's another way we can verify.
Perfect. So I know right next to you, Albert, you have the LifePak 15, which is our monitor, our cardiac monitor, as well as our defibrillator. So before you were talking about pacing, so maybe you could walk the folks at home through actually what the, how to turn the LifePak on and what it looks like and what pacing looks like on the screen.
Yep. So this is our LifePak 15. You may have seen on TV. And somebody being in the hospital, you're going to see the little heart monitor and the bloop bloop. So that's exactly what this is. What this can do, it can take blood pressures. It can also take SpO2, so telling us how much oxygen you have. This also is the Untitled CO2 monitor that I was talking about earlier. It can read what kind of heart rhythm somebody might be in. So you're going to put a 12 lead EKG on them, and you can tell if somebody's having a heart attack or in some sort of arrhythmia, like something that's beating really fast or really slow, like I was talking about. So if it's beating really slow, we might pace somebody. So you're going to take electrical pads and place them on the patient, and then you're going to go into the pace setting, connect the electrodes, connect the pads, and then you're going to set the heart rate to what it should be. And then you're going to pace them from there, and hopefully they'll have a good response to it.
Yeah, and there's also some medications you can use in conjunction with pacing to help maybe control somebody's heart rate or heart rhythm.
Yeah, so it kind of depends on how sick they are. If their heart's beating slow but they can compensate for it and they're awake and talking to you, you might go to some medications like epinephrine that can help speed up the heart. You'd put them on an epinephrine drip, so it kind of gives a long, drawn-out medication rather than just giving it all at once. Or if they're not doing so well, maybe their blood pressure's low or they're not mentating because of their heart, that's when you would go to the electricity.
Okay, so now we're just going to briefly go over what we call here at the department our Pelican box. And this is just a hard shell case that contains pretty much every medication that we as licensed professionals in the field can give to patients. So Albert, if you just want to pick out a couple of medications, obviously folks out there, you can see that we have just an enormous amount of medications that we can give to somebody if they're having a medical emergency. But if you just want to pick one or two that you think are something you want to highlight to everybody, that would be great.
EMT Basics and A's can give some of these medications, probably about 5 or 6. But once you get into paramedicine, it opens up a whole door of different medications you can give. So just talking about a few of them, again, if somebody's heart rate is going too fast, we can give something called Cardizem, which is a calcium channel blocker. It might be a little bit too much, but so basically it's going to change the chemical makeup of how your heart is working, and it's going to slow your heart down. Another one we can give is Lopressor, and that's just simply a beta blocker. And let's see, another medication we could give, TXA is kind of an interesting medication. If somebody is bleeding, we can give that, and it helps the patient clot. So it kind of helps themselves stop their own bleed. But I mean, there's a whole list of medications that we could get into. I mean, you can see the box; it's pretty full of different kind of stuff.
Yeah, and I mean, it goes anywhere from like the medications that Albert was just talking about, which are very specific to certain things, and we even go to where we have some Tylenol here that we can give. So from anything that you could an individual could potentially experience in the field for a medical condition, we have some sort of an intervention here that we can do to help remedy whatever emergency is happening. So Albert, thank you for taking the time to speak with us and give this information out to the Bedford community. And I also wanted to personally say thank you for stepping up and becoming a paramedic. It's a very big deal, so you should be proud of yourself, and thank you for your commitment to the community. Thank you. So I'm Captain Tim Lavoie of the Bedford Fire Department. Please check us out. Our webpage is bedfordnh.org, and we're on Facebook as well. Thank you for watching.